Welcome, parents and caregivers, to How to Become Your Child's Most Powerful Resource for Eating Disorder Recovery. My name is Rebecca Brown. I'm a LPC and certified eating disorder specialist and supervisor. I'm also a certified intuitive eating counselor as well as a recovered clinician. I run an eating disorder specialty outpatient clinic with my two wonderful colleagues named Grace Evans and Sarah King. Together, we have over 30 years of experience in eating disorder treatment at all levels of care. I've worked for the last several years as the director of a prestigious and well-respected inpatient eating disorder treatment program, as well as a consultant for nationwide eating disorder treatment facilities. We have a vast perspective of this illness, and one thing that we've come across time and time again is that parents are really underserved in this treatment process when their kiddo has an eating disorder. And so this is one area where we feel really strongly that we can help not only parents, but we can help the child recover so much by empowering caregivers. So what we do and what we believe is that parents' training, support, and involvement is the missing link in someone's recovery. And what we do is we help parents step into the role of recovery coach for their child. We want parents to know that no one is as powerful as you are to be your child's empowerment for recovery. We have seen that the neurobiological bond that you have with your child is a missing component to supercharge recovery. And what that means is that what we do doesn't have that biological component. So if we can teach that to you, it supercharges recovery. I want to talk a little bit about caregiver burnout. So what I hear from parents is, I'm not sure I can do another thing. And we see burnout, and burnout is real and true, but that's because of a few different things. Caregivers don't burn out because they're caregiving. They burn out because they don't trust that their efforts are making a difference for their loved ones. Or even more difficult, they fear that what they're doing is making it worse. What we do is we teach caregivers like you to work smarter, more efficiently, and to work less. We know that caregivers who feel overwhelmed, ineffective, and burnout are also associated with lower treatment outcomes for their loved ones. And on the flip side, caregivers who feel effective, calm, and confident, as well as balanced, have loved ones that have better treatment outcomes. And we know at the end of the day, that's what you want as well. Now let's talk about some scary truths. Scary truth is that someone dies as the direct result of an eating disorder every 52 minutes. Also, eating disorders have the second highest mortality rate of all psychiatric illnesses, and this is only second to opiate addiction, and we've seen how devastating opiate addiction can be. Also, hospital admissions for adolescents with eating disorders have more than doubled during the pandemic. And there are not enough qualified professionals to meet this demand. And so what we know is that parents have a huge ability to help their child recover. And if we can teach you that, that helps them and that helps you. And what we do is equip you to step into that full potential, and we prepare you to face the challenges of dealing with an eating disorder. No one can recover from a life-threatening illness alone. The bright spot is that full recovery can and does happen. We've seen it, and it is very rewarding. And we know that parents who understand their role in treatment are equipped to do it, and they are the best resource for their child's recovery. So what we want you to know is, in order to become eating disorder specialist, it takes any professional at least an additional 2 years of training specifically in eating disorder care to be able to manage that. And yet we see that parents are often plopped into this illness with no training, no expertise, no understanding of rhyme or reason of what's going on with their child. All they know is that their child has slipped from one version of themselves to another and that they're dealing with a truly critical illness. So we want you to understand that it's normal that you don't know. Of course you don't know. Professionals take time to have to know and understand the intricacies and nuances of this disorder. So our job is to support you so that you know you're equipped and you're backed. We offer 3 months of working with our team of certified eating disorder specialists. We work in these 3 months to help you strengthen your relationship so that it can stand up to the eating disorder. And we utilize an intervention that's inspired by emotion-focused family therapy. This is an intervention that has been known to stand the test of time with eating disorders. It's evidence-based. It's seen in family-based therapy, as well as other treatment modalities, and takes the neurobiological reaction and bond that you have with your child and teaches you how to build a bridge towards recovery for your child. We'll teach you how to remain steady, calm, predictable, and to provide unconditional support in the face of some very challenging situations. We've had parents that have been able to do this in the face of throwing food across the room or throwing dishes across the kitchen wall. These are challenging disorders and they will bring out the worst in your child. And so we teach you how to deal with that, how to bring that level of activation down, and how to take the next right step forward. We also help you in creating a united front with your family so there's no space for the eating disorder to flourish. And we help you to know that recovery is towards something, not away from the eating disorder. You'll learn how to respond when your child resists treatments or reacts with that huge rage or threatens to harm themselves or increase their eating disorder behaviors. We'll help you to learn to see your child even when you don't see them, even when the eating disorder is in full control. We help you to understand, to get inside of your child's head, to see the situation from their shoes so that it can help you help them. We help you to understand what to expect from the eating disorder and how to provide emotional support through the most distressing and upsetting times in the illness. We help you to have a guide along this really difficult path. You'll be supported in understanding how to manage and overcome the fears of making it worse, the fear about damaging your relationship, or the fear that your loved one might harm themselves. These are all caregiver blocks that often stand in the way of any parent who's helping their child through a difficult mental illness. We'll help you to understand that food is the medicine of treatment here, and we'll help you know what to do to provide meal support. Sometimes that's one of the most difficult things. So we'll guide you in providing appropriate and helpful meal support to your child. We'll also teach you how to be a part of the treatment team. So all eating disorder care should be multidisciplinary care, but that treatment team should also include you. And it's really important that you show up as the expert on your child for that treatment team. We'll teach you how to work with all of those specialists and who you need to be on that team. And we'll help you have an understanding of the right level of care that your child might need, or understanding of what that level of care that your child's treatment team is recommending. We'll help you navigate treatment. Some of the most difficult things we've heard from parents are understanding their child's diagnosis, understanding why it changes, what it means when it changes from one diagnosis to another. Also understanding those levels of care, that they flow from acute to residential to partial hospitalization, intensive outpatient, and outpatient. Will help you understand why your child might be at that level, what they need to progress through the levels, and also how to get treatment at the level of care that you might, your child might need care for. A lot of times these Treatment facilities are few and far between, and so you have to navigate all across the country. And it's really helpful to have a partner who is connected and who understands. And finally, we'll help you navigate the treatment team, understand which components, which professionals need to be a part of that, how to navigate insurance difficulties when insurance pushes back against what your child needs, despite treatment recommendations from your professionals. And will help you connect with your role and also help you understand the role of your kiddo in the treatment team. We'll also help you understand recovery. So we'll help you understand that recovery happens in many phases. We'll teach you how to spot where your kid is in recovery and what they might need to progress to the next step and how to achieve full recovery. We'll also help you to become current culture detectives and help you understand what current culture is versus recovery culture. We'll teach you how to see triggers in the environment for the eating disorder. We'll teach you how to respond to those and to be prepared for them. For when Aunt Alice mentions body comments about your child at Christmas dinner, we'll help you to be ready to be supported with your child and to give you the verbiage, to give you the dialogue and give you the skills to turn those into learning and growing opportunities for your child struggling with an eating disorder. And then we'll also help you to become aware and to reduce the triggers in their environment. Parenting through eating disorders is for you if your child has been diagnosed with an eating disorder. If you understand the seriousness of an eating disorder diagnosis and know that time is precious to intervene, that the earlier intervention possible, the better. If you also know and are willing to step into your role as the very most important person in your child's life. If you're open to the idea that parents do not cause eating disorders, but also that people do not choose to have them, and also the idea of self-blame stands in the way of any caregiver, and how to get rid of that, how to let that go. Parenting through eating disorders is also for you if you trust that full recovery is possible and that the road to recovery will bring challenges that can absolutely lead to amazing growth for your entire family. We have to tell you, Parenting Through Eating Disorders is open for a limited time only. Supporting you so that you can support your child to full recovery is our #1 top priority. And we limit the number of families that we work with so that we can provide you our daily attention, so that we can provide you quality educational programming, and so that we can provide you with the resources and connectedness for deep healing recovery. We only open for 5 families at a time when we do open, and we'll close this window after 1 week. If you think that this might be a resource for your family, the next steps to take would be to email me. I'll send you a calendar link so that we can schedule a 15-minute phone call. We'll see if we're a good fit for one another and if we're the best choice for you. Regardless of what happens, you'll have that 15-minute block where I'll provide you with resources and a consultation with a certified eating disorder specialist. This is how you can reach me, Rebecca at parentingthroughed.com. That's parentingthroughed.com. We really look forward to working with you. We wish your family strength and connection during this very difficult time, and we wish for full recovery for your family.